What is adult ADHD and what are the symptoms? I'm Dr. Trish Leigh. Let me tell you all about adult ADHD. Okay, so first of all, what is adult ADHD like and what characterizes adult ADHD? Well, the idea of adult onset ADHD is actually a misnomer. That's not a thing. And I'll tell you why it's not a thing, because ADHD is a neurodevelopmental disorder. It's actually one of the most common neurodevelopmental disorders, which means that it occurs early in development for children. And many children, not the majority, but some can actually grow out of ADHD because their brain develops out of a delayed pattern and they no longer qualify, thank God, and they no longer have the symptoms of ADHD. So let's talk about what happens when a child has ADHD across their lifetime and then that becomes adult ADHD, which happens in the most cases in the majority of the time. So what is it characterized by? What adult ADHD is characterized by is the same types of symptoms you might see in children, like distractibility, lack of focus, difficulty attending, impulse control, poor judgment, need to move or fidget, easily being distracted. But the way that plays out for adults can actually have much more devastating consequences. And yes, it's devastating for children who it completely impacts their ability to learn, to engage in the classroom and the learning environment, to establish social relationships if their behavior is difficult for others to handle. But the way that plays out in adulthood is that there is a much higher percentage of divorce in people who struggle with ADHD. People with ADHD lose their jobs or have difficulty with employment with much more frequency and regularity. There's procrastination when it comes to either on the job duties or at home, which leads to a lot of those challenges. Executive function skills can struggle, so the ability to plan and organize and stay on track can really be difficult, and it plays out in relationships and in employment. We know that there's a much higher percentage of people with ADHD who struggle with depression and anxiety, so there might be suicidal thoughts. There's a very high percentage of people who develop addictions to alcohol and drugs and behavioral addictions, especially when it comes to internet usage these days. Those addictions can really feed the brain pattern that's at the core of adult ADHD. And that's why the behaviors exist. Let me get back to just a couple other symptoms and then we'll explore that just a little bit. But people with ADHD have higher percentage of being arrested or having difficulty with the law. So there's articles on how our prisons are filled with men with ADHD, which obviously isn't cool, since in my world of EEG, the ADHD brain pattern can be healed. Many people with ADHD don't file their taxes or don't file them well, so they have financial problems. There's a whole host of issues. Please check out the image that I am sharing, because there's excessive talking, hyperactivity, mood swings, flying in both directions, impaired social, occupational, and recreational functioning, difficulty with concentration and focus, getting tasks done, nervousness and fidgeting and worry. So what we know about that is that the pattern for ADHD has a high comorbidity rate with anxiety. So more than not, the ADHD pattern exists with the anxiety pattern. If someone experiences chronic anxiety because they have the brain pattern that creates and perpetuates anxiety, many times that can shift into depression for the person, which is a different brain pattern that basically is exacerbation of ADHD and anxiety. So what's at the root of ADHD is a brain performance pattern in where the brain is using much too much slow processing speed. It is called theta. So when theta is being used too high, it's difficult for the brain to use the optimal pattern of perfect processing speed, and thus that person has all the symptoms because their brain is running too slow. what happens in the comorbid anxiety pattern is because the brain is operating too slow, and I always call that braking of the brain has to kick it into overdrive and push that gas even harder to offset all the braking. And now you have a brain that is gassing and braking, and all of that nervous system being taxed by all the gassing and braking is what can then lead to depression, because the brain needs a break from all of that. Okay, so what do you do about it is you use neurofeedback. And what neurofeedback can do for you is it teaches your brain to make more perfect processing speed in the middle and to decrease those speeds in the extremes. And if you visit my website at drtrishleigh.com, I've actually written a blog post on the 3 levels of neurofeedback. There's more simplistic, which obviously is much more affordable neurofeedback. And then there's 2 other levels that are more individualized and personalized. But I'm here to tell you that even if you use the most simplistic version, that can really, really help you. So visit my website under the personal neuro training tab, because you can explore how that can possibly help you, because I'm telling you, it can help you. And there is a truckload of science that proves what I say is true. And I'm going to share more videos on the science coming up. So stay tuned for those videos also. Don't forget to like and subscribe if you're getting value from these videos, because there's going to be more of them. Okay, so I hope that helps you out. And remember, control your brain or it'll control you.